Ever feel like you're taking 2 steps back for every step forward? Like all the progress we've made is being undone through budget cuts and policy rollbacks? Well, impact shapers, you're not alone. Today, we're taking the long view about how change actually happens in public health and how we sustain hope and impact during challenging times. You know what they say about public health? When we're doing our job well, it's invisible. I used to think that progress in public health was a steady, incremental climb. But as I've studied our field's history, I learned something interesting. That progress is not linear at all. It's actually cyclical. Nearly every major public health achievement has followed this pattern of advancement, then resistance, followed by what seems like rollbacks, just to eventually get to that stage of breakthrough. Think about it, from water fluoridation being called communist mind control in the 1950s, to early seatbelt laws being attacked as government overreach. Public health has always faced resistance, especially after initial successes. Here's where understanding the history changes everything. Rollbacks aren't the end of the story. They're part of the pattern. And understanding the pattern gives us perspective and power. Let's break down what I call the progress pattern framework in public health. First, the advancement phase. When public health identifies a problem, builds evidence, and creates initial interventions. Think early tobacco control efforts. Second, the integration phase. When successful approaches begin to be adopted widely, policies get enacted, funding increases, and systems start to change. Third, the resistance phase. This is where we often find ourselves now. Once public health measures succeed, people forget why we needed them. Budget priorities shift, and programs that once had bipartisan support get caught up in ideological battles. But historically, this is almost always followed by the consolidation phase, when the most critical elements of public health progress get permanently woven into our systems and culture. Not everything survives, but the core advancements do. They become the new baseline. Take tobacco control as an example. The Surgeon General's report in 1964 started the advancement phase. By the 1980s, we were in the integration phase, implementing indoor smoking policies. Then, by the 1990s, the tobacco industry pushed back. That was the resistance. Yet, today, smoking rates have plummeted. Indoor smoking bans are the norm, and cultural perceptions of smoking have shifted. The resistance didn't stop progress. It's just part of how change happens. So how do we apply this understanding to sustain hope during challenging times? First, practice strategic hope, not blind optimism. Ask, what elements of recent progress are most likely to survive this resistance phase? Second, look for pockets of possibility. When state-level recognition for community health workers stalled, we refocused on health system adoption and local initiatives. Years later, that groundwork made possible the state-level policies we'd originally sought. Third, build long-game infrastructure. Create people-powered systems that can weather policy changes. Training community leaders, documenting impact evidence, creating networks that don't depend solely on government funding. Let's make this concrete with a tool I call horizon mapping. All right, go grab something to write with. Draw 3 horizontal lines on your paper. Label them. 1-year horizon, 5-year horizon, and generational horizon. On the 1-year line, what actions can you take now, even with current constraints? On the 5-year line, what foundations can you build that will enable bigger change when the cycle shifts? And on the generational line, write your lighthouse goal. That's your North Star that guides all of the work. When facing rollbacks, ask 3 key questions. What can we protect? Be strategic about identifying critical elements to defend. What can we document? Use this time to strengthen your evidence. Where can we innovate? Constraints often spark creativity. Impact Shapers, we're part of a long lineage of public health workers who have navigated these cycles before us. From early sanitation engineers who faced pushback for their radical idea of clean water, to HIV/AIDS activists who kept pushing forward during the darkest of days. When we understand the rhythm of change, we can play our part with both determination and hope. This week, complete your horizon map and identify at least one action on each timeline that you can take, regardless of current constraints. Share your long game strategy using #PHCLongGame. Next time you feel discouraged about rollbacks, remember that you are not witnessing the end of progress. You're just experiencing a natural phase in how lasting change happens. Your persistence isn't futile. It's exactly what leads us toward the next breakthrough. This is Veronica with Public Health Curated, where soul care meets system change. Keep shaping change with the long view in mind, Impact Shaper. The arc of public health may be long, but it bends towards healthier communities when we stay in the work.